The Nigeria's Federal Executive Council has approved a 6.07 trillion naira for the implementation of the country's second health sector plan, earlier presented by the National Health Council on Health in June this year. Dr. Ifeanyi Nsofor, the Chief Executive Officer of EpiAFRIC, joins us from Abuja to review the health plan and its impact on the country's health sector. Dr. Ifeanyi, thank you so much for taking the time out to join us. Now, this is a second plan, health sector plan. The government is taking a second shot at putting together a holistic plan for the country. What are your thoughts in terms of the layout of this plan and where we're going to start?
Okay, thank you so much, Esther. It's great, speaking with you again. I think first of all, we need to give credit to Professor Awoniyi, the Honorable Minister of Health, the partners who have supported this, and the committee led by Professor Ejembi that came up with this plan, the second National Strategic Development Plan. And just to stress that, the plan is not just a federal government plan, but the different states, came up with their own plans, and everything were now, all the plans were coalesced into one to give us the National Strategic Development Plan. And it's a good thing that it's budgeted for, so we know exactly what it is going to cost. So in a way, those are the positives. However, let's also look at the fact that 6 trillion naira, when you break it down per capita, it's just about 30,000 naira per person over 5 years, because the plan is for 5 years. So how realistic is that? And one other question we have raised through our organization, Nigeria Health Watch, is we've asked the question to say, to what extent is the plan based on evidence? Is it evidence-driven? If you look at, the different plans, the different activities and objectives of the plan, to what extent are they based on evidence? From Professor Awoniyi's news briefing yesterday, he said that, hopefully we're going to get, if the plan is implemented to the latter, we're going to get at least about 30% reduction in maternal mortality. But again, to what extent is that based on evidence? And the states, the plan is still going to be presented to the National Economic Council and the Governors Forum for, hopefully for the plan to be adopted. So these are some of the issues we're raising,
okay,
with the.
Now, Dr. Ifeanyi, if I could just come in here, we'll talk about the plan again in detail. Just a few steps back to the first plan that we had, which was meant to run from, I think, 2015. What would you say went wrong? Because there were 52 targets and only 2 at the end of the day were achieved. What would you say went wrong, and what were the lessons you'd say that we hopefully learned from that experience?
Okay, so that first plan was really focused on, health system strengthening, to strengthen the health system so that at least our health system can, can stand on its own without, so much donor support. But, as you know, that really failed woefully, because to a large extent, our health system is being driven by, donor funds, and there are so many vertical programs on their own that are operating without, the commensurate government leadership. So I can say that that focus of that plan on health system strengthening failed because somehow, across the different levels of governance, federal, state, and local governments, the leadership at those levels did not take, charge, of governance for the health sector.
Okay, now, Dr. Ifeanyi, I want to take you back also now, because I've spoken to a number of analysts and doctors, and they say that, for Nigeria's health sector, the reason why it's failed for decades is inadequate funding, especially starting from our annual budget. And the WHO has recommended that for countries to effectively fund their healthcare sectors, they need to allocate at least 13% of their annual budgets to the sector. And Nigeria, who is one of the members of WHO, is also a signatory to this recommendation. That on the one hand, there's also the AU accord that Nigeria signed in 2001, the Abuja Declaration, where Nigeria, along with other AU members, also pledged to fund, to set aside at least 15% of its annual budget to health. That hasn't been the case. We've allocated far less in percentage terms to our funding, to our sector. Would you say that is where our problem, the root of this problem lies, the fact that at the national level, at the national budget, we're simply not allocating enough to the sector?
Okay, I think that's one of the reasons, really, because even if we allocated all all federal budget to the health sector, I'm not sure it's going to finance everything that we need. I agree that the issue here is health financing. However, after the Abuja declaration, so many financing options have come up, and at the global level, at the continental level, even in Nigeria, the push now is for universal health coverage, and not just government budgeting 15% of the total budget, for health. Universal health coverage. How can we ensure that people go to facilities without, having fears of whether they can afford to pay for it or not? And one of the ways we have pushed for this through Nigeria Health Watch is to say, the National Health Insurance Scheme was set up to provide health insurance for Nigerians, so that people to pay some kind of prepayment, co-payment, and government will cover, part of it, for us to have the kind of financing that we need for the sector. The National Health Insurance Scheme, almost 13 years since it was set up, has failed woefully. You have just about 1% of Nigerians are covered by health insurance. So in as much as we're pushing for government to budget 15%, but ultimately it lies in having, if we're going to have success, we must have innovative financing mechanisms. And one of it is having health insurance for every Nigerian. And also, depending on the state or even at the federal level, some level of tax funding. But let me say that for the past 3 years, the National Council on Health, which is the highest decision-making body in health, has approved for states to begin to sign their own health insurance laws. At the last count, about 18 states have signed health insurance laws, and in those states, once they start implementing, it is mandatory. And that is something, again, that I don't know if the team that worked on the National Health Strategic Plan took it into consideration. I
was going to ask you that too, if that is also part of this plan. Because obviously it's very important. Health insurance is a big part of it, and also getting all 36 states, including the Federal Capital Territory, to buy into this will also be very important.
Yes. Yes, absolutely, because one of the challenges of the NHIS at the federal level is that it's not mandatory. So it's not by force for you to buy health insurance. But the state health insurance schemes that are being signed now, 18 states have signed, are mandatory for residents of those states. Because if we have to move our health financing forward in Nigeria, we cannot have health insurance schemes that are not mandatory. You shouldn't have a choice. For example, it is a must for you to have health insurance for your car. Sorry, for insurance for your car. How come it's not mandatory for us to have insurance for our health? And that's one good thing that state health insurance schemes, are beginning to do, that I think is going to help us pool the funds that we need to move our health sector forward. Okay,
finally, we have about 10 seconds left. Are you optimistic? Are you very hopeful about this new plan, this new 5-year plan?
Yes, I'm optimistic because, again, it took a lot of partnership, which is very key. And I like some of the components of the plan, like the focus on mental health, which is lacking in Nigeria, the focus on prevention of infectious diseases. You know that the Nigeria Center for Disease Control has done so much to move that space forward. So these are some of the areas that I think are very good. But ultimately, Nigerians have to watch closely and hold government accountable at the federal, state, and local government levels if we have to.
Okay.
If we have the health sector of our dreams.
Dr. Ifeanyi, thank you so much for your time today. Dr. Ifeanyi Nsofor, Chief Executive Officer of EpiAFRIC, looking at Nigeria's new health sector plan. We'll take a quick break. Open Exchange will be right back in 2 minutes. Join us again.